Challenges facing Canada's healthcare system is reopening the debate around private and public healthcare options. While some are in favor of increasing private care providers to take the stress off the public system, over half of Canadians believe more private healthcare options will only worsen the healthcare system. That's according to the latest poll by the Angus Reid Institute, which also found almost 90% of Canadians are worried about the medical system, highlighting staffing shortages, wait times, and difficulty accessing family doctors as top concerns. When asked if privatized care would help the situation, 50% of Canadians surveyed said no, it will only damage the healthcare system further.
The Canadian system, yes, we need a lot of investment. We need a lot of work to make sure that our healthcare system, which is under stress, is protected and is there for all Canadians, all Manitobans. But that does not mean going down the private healthcare route.
Thomas Linner, provincial director with the Manitoba Health Coalition, a non-profit, non-partisan organization, says Canadians are right to be worried about healthcare in the country. Linner agrees with those against increasing private care options. His biggest concern is that a credit card could end up mattering more than a health card when accessing services.
We need to take real action to address the staffing crisis, the nursing crisis that we have in healthcare across Canada, but we know that those solutions exist in the public system, not in private for-profit healthcare.
When people think of private, they think of expensive. When in fact, at our clinics, you can get a visit for $42. The same visit for say a backache or a UTI or some primary care concern would cost the taxpayer between $300 to $350.
Dr. Adam Hoffman, owner of Algomed Clinics with offices in Quebec and Nova Scotia, says his practice can be about 8 times more cost-effective dollar for dollar compared to the public healthcare system. Hoffman agrees the Canadian healthcare system is in trouble and says if public health could fix the issues, he would stand behind them, but says it's not working. He believes private healthcare is another tool that could help solve the crises playing out in hospitals across the country.
The dogma of, public healthcare or bust is frankly taking us to bust.
According to the survey, men are much more supportive of privatization than women, and those with higher household incomes are also more likely to lean towards private healthcare. In Winnipeg, Mark Neufeld, City News.